Okay, so this is our inaugural podcast with the World Dentofacial Sleep Society. I'm so excited to introduce our guest, Dr. Rafael Pelayo, a good friend. I'm going to do a little intro here about Dr. Pelayo here. He is a prominent pediatrician and sleep medicine specialist at Stanford University. He's known for his work in pediatric sleep disorders, his leadership in sleep health advocacy, and his role as a clinical professor and author. He wrote a book called How to Sleep, which is autographed in my library. Thank you very much, doctor. And he has a really cool role at Stanford. He teaches a class called Dement Sleep and Dreams at Stanford, which is well known.
Thank you for
Thank you
the
for being our
honor.
first guest.
I think it's perfect. The flyer that you made,
Yeah.
by the way, those of you out there in the audience, if you look at the flyer that Dorothy created, it's actually a picture from the World Dental Facial Sleep meeting in Singapore. So that's where that photo comes from. And I've had a lot of fun at medical sleep meetings, but the dentists have even more fun. So I really enjoy going to your conferences. It's been a pleasure doing that. That was this fantastic meeting. So I think anybody out there who's never gone to a World Dental Facial Sleep meeting, make sure you go to the next one because they know how to have a good time. It's just wonderful. Great people too from all over the world. This really appeals to lots of people. And to be in your first podcast, I think it's special for me because it's also emblematic of the field where you have a dentist and a physician working together. And that's exactly what you're trying to do with the society is bring people together because we share these patients and they're going to be helped by our common expertise. So again, it's a privilege and an honor to do this with you. Thank you, Dorothy.
Thank you so much. Yes, our next meeting is in Baltimore, Maryland in June. So we hope to see you there. But why I'm really interested to talk to Dr. Pelayo is I am a pediatric dentist. And so this special population is something that I see every day. And it's just really exciting to see the field move into the adolescent realm. And I'd love to hear your perspective on what you've been working on, how you see the field evolve, and things of that nature that the audience would really love to hear about
Thank
from
you.
an expert like
Even though I'm
yourself.
trained in original pediatrics, my focus was never to be a pediatrician. I did child neurology with a focus on sleep from the very start. And I learned that because I work with adults and kids. In fact, currently I see a lot more adults and kids because in the end, what we practice is a version of family sleep medicine, I like to think of it. And that's what we have to do it. That's the beauty
Mhm.
of having dentists involved because you're looking directly in the mouths and you can impact these children's lives. And Dr. Audrey Yoon, who the president, founding president of the society, she was kind enough to allow me to be a co-author on one of her papers, the roadmap paper. We're talking about the possibility of ultimately not just treating a disease but preventing it. And we're not going to prevent it in adults unless we address it in children. That was always a vision of Dr. Gimeno, who described opioid resistance syndrome and did the original work at Stanford Sleep Clinic. That we have to do this and take care of them. We know my entry into this as a medical student in 1984. I know before you were born. 1984, as a medical student, was working with teenagers specifically because we had identified a condition of teenagers who were thought to be depressed, but in fact had a sleep disorder, which at the time had never been known before, called delayed sleep phase syndrome. So once that was described in
Mhm.
1981, as a medical student in 1984, in the mid 80s, I was tasked with trying to find out the prevalence of it. So I visited high schools and junior high schools in the Bronx, New York, going to medical school, and found that there was an association between this tendency to be a night owl and have delayed sleep phase and having depression. And the beauty was that these were kids and young adults who were depressed and were not responding to medication. But once you change their sleep schedules, the mood improved, and especially when you use light therapy. So all of a sudden, you can change somebody's behavior, somebody's feeling, and their mood by just improving their sleep. And that's how I got into this. My first research project with Michael Thorpe in the Bronx. Michael Thorpe, a big leader in our field, of course, and one of my first mentors. I got to Stanford later after Dr. Thorpe's recommendation, and I got to work directly with Doctors Dement and Gimeno, who helped pioneer this field and move it forward. So I've been very lucky to work with tremendous experts. And what I see is just an extension of their work moving forward, where there's greater acknowledgement. And even though I got involved in this in the 80s and started at Stanford in the early 90s, people now in 2026 talk about, oh, this is a thing now, like it's a hot topic, but it's been around for a long time. Those of you who are new to the field, welcome. There's never been a better time to get involved in sleep. There's greater acceptance, greater awareness of it, more treatment options. We're really going in the golden era of sleep apnea treatment. It's just never been better, and many opportunities to do it. So it's exciting time to do it. And if you've been doing this for a while, you've seen the arc. You've seen it change from a curiosity to now much more of a mainstream topic to a condition where it was viewed as research at one point, and now insurance companies pay for this. And they always make the point the insurance company pay for treatment, not because they're nice, it's because it's cheaper to treat it than to treat the consequences of untreated sleep apnea. And see it go from there to now worldwide. There's not a place in the planet where people are not aware of sleep apnea. Every medical school around has it. When I first started, there are entire states that didn't have sleep labs yet. Entire states were wide open. And now every medical school in the United States has somebody involved in sleep or sleep research. And pretty much every country, I believe, will have somebody involved in this, especially in Asia, which is such a common condition. And we started off by thinking, well, this is a disease of old fat men. And now we know it's not really true. That was perhaps our original sin to think of sleep apnea, like Charles Dickens described it, as these overweight people. When we have so many young people who are thin, who are healthy otherwise, who have sleep apnea, how sleep apnea can show up as insomnia. It's a condition people think, well, I'm tired because I'm not getting enough
Mhm.
sleep. Well, sleep apnea is a condition where the more you sleep, the worse you'll feel. So it's kind of like I say, you can be overweight and you can also be malnourished at the same time. And people don't appreciate that sometimes. So I think the future is very bright for our field because greater acknowledgement of it. The CPAP machines have never been better. I know that as a dentist, you're probably not looking too much to use CPAP machines, but they've never ever been better mass than before. The quality of the oral appliances has improved also. We're talking about maybe next year using medication to treat sleep apnea, hopefully effectively. That'll be there too. And surgery, of course, is a whole topic unto itself. There's amazing amount of different surgical options available to it. In fact, there's no reason anybody should be snoring anymore. There's no reason anybody should not be waking up refreshed anymore. Before it was lack of access, and that's been taken care of. The barriers are being lowered. Our greatest barrier is just people being open-minded to diagnosing and treating the condition.
Mm.
Patients being able to just examine our patients and think of them and being open to using it. You know, one of the things, Dorothy, that's happened thanks to Audrey and her leadership and other people at the University of Pacific, UOP in San Francisco, they now routinely are screening all their new patients for sleep apnea. And they've helped
Yeah.
partner with Stanford to create a sleep dental medicine fellow. So I now have had for the first time, I have
Mm.
9 sleep apnea fellows. Right, nice. I have 9 sleep apnea fellows, but now I have had 4 dentists, orthodontists doing sleep medicine with me. And one interesting thing about them, I've learned from all of the dentists, and they keep me honest, make me look a little more closely at the mouth when they're around me. But one of the things I found interesting about working with the dentist was they had never seen anybody successfully use CPAP before. And because if the
Mhm.
patient's happy with their CPAP, they're not going to go see the dentist and get an oral appliance made. So we have this referral bias that we're all a part of because we're all working in our silos. And the society is to break down those silos and make us see each other's perspectives. And it's like that old joke everybody knows about the blind people describing an elephant. Depending on what part of the elephant you're touching is what you see. So dentists and surgeons saying that nobody likes CPAP, and then patients come to our clinic and say they love their CPAP, and it's kind of nice to see that. And there's room for both.
Mhm.
Obviously, there's room for all of this stuff. It's just getting better. So it's an exciting time. So anybody who's new to this field, welcome because there's plenty of room. Hundreds of millions of people that have untreated sleep apnea so far, and you're going to be helping them. Plus, it's fun. If you treat somebody with sleep apnea, they get better. They make happy. I always joke that I've made many wives happy. Some husbands too. You know, snoring is one of the most common reasons for divorce, and you get them sleeping better. People are really happy about that. So it's a pleasure to take care of this. And it's not just sleep apnea, of course. There's many more sleep disorders just than that. But that's the one that we deal with the most and the most overlap that we have with our dental colleagues. Yeah.
Yeah, right. And I've even noticed when years ago when families would come in and we do our screenings, they really didn't know where to start and or even just the thought of mouth breathing and that we can identify these things in our dental appointments. And now I'm getting parents coming in with a list of questions and they're already primed. They are doing their own research. They're noticing things in their own children and there's education out there that whether we like it online because it's missing in our dental schools or medical schools or whatnot, but they're understanding the need for interdisciplinary care and managing their child from like a wellness quality of life and seeing their child thrive versus just like, oh, they're sleeping through the night now. That was usually the only thing we would ask. Are they sleeping through the night? Oh, great. Or I'm not sure. And now they have videos, they have data, and it is really fun to kind of talk about, well, what are your concerns? How can I help you? What really is important, and how can I help you troubleshoot some of these things that keep you up at night because of your child
Yeah,
not doing
it's a
so
really good
well?
thing. We have a it's easy to be optimistic about the field, but we also have a lot of things to criticize about the way we've delivered CPAP. We've just done a lousy job of delivering CPAP to people. Uh, uh, this is a routine topic for me to deal with this. And a lot of people will say, well, the patient's doing well because they get some printout or some data download, but they've not actually seen the machine and how they're doing with it. We address the chief complaint. How often they actually look at the device, and people just assume, well, you're not going to like the CPAP. Just check off that box because you're going to get surgery later, and you have to fail CPAP first. But you got to find out why they fail. That's a
Yeah.
question for me that I ask a lot. And somebody said they didn't tolerate CPAP. I'm like, well, exactly what happened. When I was in high school, I used to sell shoes, and anybody who's ever worked with me knows I used to be a shoe salesman in high school. And if I sold you a pair of shoes that gave you blisters, is it the shoe's fault or the foot's fault? It's the shoe's fault. So if the CPAP's not working, I need to know why. I can understand you not liking CPAP. It's like I compare it to wearing glasses, right? If you say you can't read, and I'm say, well, I'm going to give you a pair of glasses. The minute you put on the glasses, your vision should be 20/20 immediately. It should immediately correct the problem. And you may not like the glasses. The frames may pinch your nose. You may have to get used to them, but the vision itself is immediately corrected. And CPAP is exactly the same way. The moment you put that thing on, you should have zero snoring and your sleep apnea should be resolved. It's a question of you getting used to it. But patients often are not delivered the CPAP correctly. And we got to spend time getting over with them and seeing what's going on. So I'm always quick to break it down, see exactly what's wrong, what went wrong with it, what was the problem? Because really it should always work in theory, right? It's not for everybody, granted, it's
Mhm.
not for everybody, but it should work. I can understand you're not wanting it, but I don't understand you saying it didn't work, because I need to understand why it didn't work. It has to be a reason it didn't work. That's how I think of this. But you're having fun in
Mhm.
your practice. How many of your patients, what percent of your practice is sleep apnea related?
Every child gets screened, and it's why it's great here at UOP, where every patient that comes through the door gets a sleep questionnaire,
Do you think
and
more
it's a
dental schools will be
conversation.
doing it? Is that, I know UOP started that a few years ago.
I hope so. I hope so. Years ago, our dental association recommended that we screen everybody. And when we brought that up, this was like 2010, maybe, or even prior to that, no one really knew what to do once you screen them. And I would still say a majority of clinicians feel the same way. Okay, I screen them, now what? And then it gets very intimidating. So there is a gap in knowledge of like what should we do, and then there's a little bit of anxiety of what if I do detect something or what next. So I think there really is a lot of
Excuse me. Sorry, I
anxiety
apologize.
about that, but I think the interest is there because we see it so often, and now we're connecting dots in what we see in our challenging patients of like broken restorations perhaps, or there's like a structural issue when it comes down to like there are functional issues that are causing failures in our restorative work. So I really am optimistic about how our field is evolving too. I always talk about this isn't just sleep dentistry. This is the future of dentistry in general. This is how oral health should be. And I think a lot of people in this field are feeling the same way, that this is just going to be standard of care once we figure out how to educate every provider. When I was at the University of Washington, we talked to our pre-docs about this as well, early screening, but it takes time to make change. Leaders in the field, such as yourself and Dr. Audrey Yoon and whatnot, really help us with the data and research, and also just high quality education. In this global society that we're a part of, we speak a common language. That's probably hasn't been there since, when first inception, when it was first developed, and having different specialists from different fields really helps to move the field further, and our patients
I
are
think it's
healthier
it's
for
really
it.
good. I mean, the awareness is really there. I hadn't mentioned to you, but off air, I just got back from Washington D.C. Um, I have a few different.
Mhm.
I volunteer
Yep.
with a few different organizations, and one of them is the Academy of Sleep Medicine, with their political action committee. And every year, the Academy of Sleep Medicine will send a delegation to Washington D.C. to meet with members of Congress. And when you first started, people say, well, what's a sleep doctor? What is that? But that's not happening anymore. They actually have real questions about their sleep and concerns what's happening. The Academy of Sleep Medicine has a legislative agenda, and it's beyond sleep apnea. Right now, we're trying to get rid of daylight savings and get rid of the clock changes. Not every country in the world, and people who are watching this podcast may laugh at us for what we do. For example, China has only one time zone. This daylight saving things is something, a self-inflicted error that we do it to ourselves every year, and it particularly impacts teenagers because they're already sleep deprived to begin with, and we take away an hour of their sleep. It becomes an issue for them. So we're trying to get rid of the clock changes and stay in standard time. That's one of the things we're advocating for. And I spoke to
Mhm,
people from both sides of the aisle. And I didn't meet anybody who was really opposed to it. They always had questions a little bit, which one is daylight savings, which is standard time. But they all want to get rid of the clock changes. That was good. And just greater awareness of the importance of sleep health for most
mhm,
people. If you ever go to Washington, D.C., and probably capital of every other country you go to, Washington, D.C., a lot of their work is done by young people. You always have the elected officials, they're the older people who run for election, but the actual work is done by young people. And one of the things that stood out to me when I first went to Washington was I never seen so many coffee vending machines and energy drink vending machines.
mm,
A lot of energy drinks are being consumed, and they told me that those machines will empty out. The Washington is running on sleep deprived people. Are very caffeinated, and it's the
mm,
culture there. So they're very receptive to what we have to say. So I think any of you getting involved in sleep, no, even if you don't think you feel you know that much, in Dr. Dement, by the way, I found this. You don't need to know much to be a sleep expert. That's what I liked about it. You don't need to know that much to be an expert because there's so much ignorance out there. When you first started, just a little bit of information, you can help others. Just knowing a little bit of sleep, you're going to help a lot of people. And that's why I think the attraction for clinicians to get into sleep, not only is there a lot of, is an unserved need, it's just fun to take care of these patients because they get better. And if you see one adult with sleep apnea, you know they're going to have kids with sleep apnea. And if you see a child with sleep apnea, you know they have parents with sleep apnea. It's multi-generational. You can help them a lot. And you probably see that in what you're
right,
doing too. Even though you're working with pediatrics, you're probably asking about the adults anyway. You can look at the parents, and people always will criticize our field as saying the research is not adequate. We can always do more research. We want to do more research. It's underfunded, right? Who's going to give the money for
sure,
it? But the beauty and
mhm,
part of pediatric sleep apnea is we have a control group, almost a case control, which is the parents. You can just look at the parents. Okay, is there,
right,
you have to ask the awkward question: are you the biological parents? And if they are, if their parents are snoring and having sleep apnea symptoms, good chance the kid's going to have them too. And they always say the same thing, well, it's only mild. Well, everybody
mhm,
begins with mild sleep apnea. Every disease is mild before it becomes severe, for the most part, right? It begins slowly. We try and prevent this from happening and from getting worse. Yes, mild sleep apnea does not mean it's normal. It just means, it's progressive illness. It gets worse. So it's a fun thing to do. So we encourage more people to do it.
mhm. Yeah, and I have to thank you for all your advocacy work. I know you've played a big role at the California Sleep Society, and I've gone to a few of those meetings, and those are really eye-opening meetings to go to as a dentist. There's not many of us there, but we're so focused on sleep apnea that a lot of the things that we learned when we went at that meetings, we kind of sat together and thought, "Wow, this is really eye-opening." Our sleep physicians are really looking at a lot more than just apneas that in dentistry that really is
There's over
kind of the
80
hot
different sleep
topic right now.
disorders. And there's a bunch of others that involve also the mouth, right? Bruxism, for example, comes to mind. Any kind of snoring may be an issue. People with insomnia. I mean, a lot of people are scared to go to the dentist, right? There's a classic thing, a classic trope. Go scared to go see a dentist. If somebody falls asleep in your chair, when they wake up, there's a chance to ask them, how come you fell asleep? What happened? Why did you fall asleep? Are you sleep deprived? So you can do a lot of things to think about other problems that are going on.
Yeah.
And also, patients feel very comfortable talking to the dentist because it's such an intimate space, and you see them much more often than say a patient for their primary care doctor only see once a year. They see the dentist a lot more often, so they're more familiar with them. They may more likely call you by your first name, for example, than they would perhaps myself. Um,
Yeah.
and you can open up the topic of other sleep issues that they may be having. What else is happening in other family members.
Yeah.
Um, yeah, so I think it's really a nice thing to do. Yeah, there's a lot of different sleep disorders. Yeah, one of
Mhm.
the things that we did in California, we're hopefully going to do nationwide and throughout the world, is give teenagers a chance to get more sleep. So California became the first state in the nation, United States, to have a law specifically to protect the sleep of teenagers by delaying school start times, so that high schools and junior high schools and public schools in California cannot require students to be in school before 8:30 in the morning. And that's not a random number. That's in line with the American Academy of Pediatrics 2014 recommendations. That was 2014. It took us a while to get it passed in California in 2019, and then it became enacted into law in 2021. And other states are interested in doing similar work, but
Mm,
it's piecemeal. We got to keep going, and we got to get more people involved. But definitely, the momentum is in our favor. Well, because once you start sleeping better, people can see the difference. The people don't want to go backwards to it. Nobody wants to get by with
right,
less sleep. Once you see the value of good quality
right.
sleep, of course, don't think about the hours of sleep. Think about the quality of the sleep. Yeah, just, I think it's a great time to do it.
Yeah. How do you see dentists kind of moving along with the field?
I think obviously there is a greater need for it. For me, as I got to spend more time with dentists, one of the things was eye opening to me. I didn't realize, but most dentists that I've interacted with are in private practice. Yeah, most sleep doctors I know are in academics. So it's a very different culture. That's a different thing. And what we do in
Mhm.
medicine is much more collaborative, I think. So where I work, we have psychologists with us because
Yes.
we have patients who have aversion to using CPAP or they have insomnia comorbid to it. So we have psychologists working with us. Our surgical colleagues are right around the corner from us. They're right there. So we're used to working together. We work with our sleep technologists versus
Mhm.
many dentists seem to be by themselves in their office, so you don't, you're the whole thing. So that's a
Right.
different way of thinking for them. And also the volume of patients you guys will see is a lot higher than what I would see. Um, I do not know how to take care of a patient in less than an hour, maybe 45 minutes, if it's kind of obvious. I need my time to go over their sleep history because sleep, in my mind, there's always
Yeah.
four components of every sleep problem. There's the amount of sleep, the quality, the timing, the state of mind. You have to go through all of them to get a sense of what's going on with them. I think how they live their lives when they're awake, how do they sleep. There's a lot of things to get out. So I spend a lot of time with each individual patient, but you guys will see many patients. You'll have multiple, one dentist has multiple chairs. When I realized that, like, this is crazy to me. I don't know
Right.
how you guys do it. You guys work harder than I do, right? I'm sitting down, look, thinking, and you guys are just jumping up and down and moving chair to chair. And so it's just a different thing
Exactly.
for us to learn how each other work. Because I can't say, well, just take your time and get a thorough history.
Right.
You can't do that. But at the same time, dentists are very innovative, much more entrepreneurial is my sense of it. Maybe I'm wrong, but just how I'm seeing it, much more entrepreneurial. So that spirit also brings innovations. How to screen, how to be more efficient, how to figure things out quicker, how to do better follow up. You guys are doing all those things in many ways. So it's wonderful that more dentists are getting more involved in this. And also the whole issue of the controversies in the field. Do you want to move the jaw back and move it forward? Do you want to take teeth out? How to align it? I had no idea the art involved in orthodontics. How is this viewed? And then how are things like
Right.
Invisalign being viewed as an opportunity or threat to some people, depending on your perspective? And these are things that you're getting into and understanding how this plays out. Um, and it's also different because insurance coverage becomes a big issue versus sleep apnea. You can have
Yes.
you can be on disability and have coverage for sleep apnea. In what they call Medi-Cal in California, people who are poor, people who are disabled, sleep apnea is covered. That's not the case for somebody who's going to go into orthodontics. It's viewed as more of as a luxury in some ways. So
Correct.
it's a different patient population, a different approach to
Yes.
them to some degree, right? So that's been interesting
Yeah.
how it is different for
Right.
us, what we see and what you guys see. And it's the same disease, right? And how we
Correct.
manage it is going to be a little bit differently.
Right. It would be wonderful someday to treat, like, how craniofacial teams have every member of the specialist and the team to round together. And then also in your advocacy experience too, those children that would not receive orthodontic care on Dentical is what we call it. And the need is so there. And it is heartbreaking to see, like, I know how to fix this and the means are not available, but we can at least help you get plugged into
Yeah,
our
I mean, I
physician
was very
colleagues.
skeptical when I first learned from Gimino about maxillary expansion because I was thinking, no, that's you have to pay that cash. That's for rich people. And I'm coming from the Bronx. I'm like, no, this I got to do something that everybody can get to. I don't want to be sending people off to the private dentist. It's not fair to my other patients. So I didn't like that at first. Now I've learned that way it's important and it actually works, and it's something that's very doable.
Right.
So yeah, it is part of just getting to know
Yeah.
each other's cultures a little bit that are different, very different. It's the way we think about these things.
Yeah. Being a parent myself of young kids and being in that environment, you definitely see families who will be more knowledgeable about palatal expansion because they are pursuing those treatments, and that becomes a status symbol in some mom circles or whatnot. Like, yeah, I'm expanding my child already. Yes, that's right. We can afford to do that, and I have the time to do that for my children. And then, you know, someday, hopefully, every child will have that opportunity to have
I think
the
it's an
treatment
issue
that
of
they
people
need.
identifying mouth breathing as a problem, right? If you have an enemy, it's mouth breathing and sleep. You should never snore, right? Right? You should be sleeping with your mouth closed. And something that to me seems obvious because I was taught this by Gimino and talked to my dental colleagues that mouthpiece is an issue. I was surprised to hear that some dentists think it may not be as big a deal. And that's me like, what do you mean it's not that big a deal? The whole
Right?
idea of having a narrow palate
Yeah.
and that the mouth breathing leads to narrowing of the palate. We know that that doesn't make sense to us, but people say, "Well, how do you know?" Sure, and that even that idea is controversial in some circles, which I was surprised to hear because to me it seems very straightforward that'd be the case. Um, it's old news, but a lot of these adults that you're seeing now, the parents of the children you're seeing, um, when they were kids themselves, the manual to diagnose ADD, attention deficit disorder, actually included that high arch palates was a physical finding of ADD. So psychiatrists and psychologists were being trained to
Mhm.
recognize a high arch palate. If they bothered looking inside the mouth, which many of them didn't, but if they looked in the mouth and they saw a high arch palate, make them more likely to diagnose with ADD. And now we know that the high arch palate is actually a sign of sleep apnea. And anybody who has a sleep disorder, if you give them a little bit of a
Yeah.
stimulant like Ritalin, of course they're going to behave better. So just because they responded to the treatment being more alert does not mean you made the right diagnosis. And those are the same parents now
Mm.
of the kids you're seeing now, right? That they have the same issues. And we did that in medicine. We're the ones who published that to look for high arch palates and ADD. And if you challenge somebody about it, they say, "Oh, well, that's not
Mm.
true. It's not a big deal." But it obviously is the case for us. Yeah. So again, I'm bullish on our future. I think it's going to be great. Things like this podcast is going to be good. Get the word out to people. It's available. So thanks for doing this.
Thank you. It's nice to have leaders like yourself who can see moving this field from different perspectives and not stay in your lane and not be open minded. That traditional thought processes can change with more information and this collaborative approach.
So a question for you: does it take longer? One of the barriers. Somebody mentioned to me that it takes longer to take care of the sleep patients than the conventional patients. Yeah, let's in the adult side. When you work with adult patients, that they are actually they throw you off because they have more questions. They're a little bit more sensitive about some things. It's different than your typical patient you've been seeing who comes in for general dentistry or just wants to get the teeth straightened out for cosmetic reasons. These patients are a little more difficult in some ways to handle, or a little bit different skill set, or more time consuming. Is that the case? Is that am I misinformed?
I think all of the Yeah, all of the above. There's definitely you could do a quick physical screener, and then when you have to explain what you're doing and what you see, depending on where the parent is, you have to meet them where their knowledge base is. Sometimes you can overwhelm a parent with all the things you can, give them. So the beauty of private practice in pediatrics is you see them so often that you can plant the seed and give them some tools to go home and monitor their children themselves and make yourself available to them. Definitely, there are some practices that you're seeing 60 to 70 patients a day, and, you just that could be just a typical, volume-based practice, and then, people who do wanna spend the time to educate beyond just, cavities or no cavities, you do end up wanting to spend that time, and answering questions. Oftentimes, when you do point out these signs that you're seeing, you bring up a whole 'nother conversation, and then it becomes like, my husband or I as a child, or what about my newborn, or what about, that's part of the issue of being in the primary practice with children is like you mentioned, the whole family gets looped into it, and it is very overwhelming as a parent. So you do have to build your practice a little differently
So those are
too.
opportunities for us in the
Um,
field, how to make the tools, make it easier for them to understand. They already know what a cavity is, right? There's
yes,
some things that are general knowledge, and that's just where
yes,
there's room for us to help our
correct,
patients by making it more understandable for them, so they know what they're coming in for. Because if you spring it
absolutely.
on them, then they think you're
Revenue
just trying to rip
digester
them
for
off,
an
or
impact.
you're trying to make money off them, right? There's some cynicism sometimes involved in this, especially with private
Yeah,
practitioners, and you want to
right.
be able to
Yeah,
get them beyond that, where they're actually seeking your help, that they come to see you because of it. I see many patients routinely that tell me I'm here because my dentist told me to come in. Uh, my dentist told me to come in.
That's
So
great.
thank you for doing this, Dorothy. Hope you have many, many, many more podcasts. Hope this is not the
Oh,
last one. I will
thank
sync this thing. Hope you have many more.
Ah, you're gonna come back, and yes, you'll come back, we'll talk some more. You have so much to offer, we think dentists should pay attention to sleep medicine a little bit more and just kind of understand just what we're looking at from a whole standpoint instead of just teeth to it. Just provides so much
Well, thank you so
information how we
much.
care for our patients.
Well, you say bye.
Thank you. And then James, thank you for your support on the back end. We do have other guests coming up. So, and then every year we will have a WDSS meeting. And then every other year they are
And
combined
World Sleep
together
makes
with
it even more fun.
World Sleep.
So this year will be in
Exactly.
Baltimore, and then the
Yeah.
following
So
year will be in Montreal, I believe.
yes, and the social events are just as fun as all the high quality learning that you will be a part of. And so it's just a great society to be a part of. And part of the vision for this podcast is not everyone has the means to travel to attend these meetings live. So being a member and having access to this information is key to spreading the word and getting education out. And then when these little snippets of our podcast, we really hope reaches people globally as well as it is a global
Yeah, the
condition
entire
that we
world
want to
sleeps.
treat.
There's no doubt. We can help lots of people.
Yes. So thank you, Rafael, again for your time. And I look forward to seeing you again in
Thank you.
person
Thank you,
sometime. So
Dorothy.
thanks for jumping on and
Thank you.
being our inaugural guest.
Bye, everybody.